Okay, hello to everyone again. Hello to each and every one of you in your respective places. Hello to my bishop, our bishop, Dr. Jimmy L. Williams. Hello, First Lady June Williams. Hello. Thank you for inviting me on. Thank you for having a desire for the people to be updated and to stay informed about what's going on with this COVID-19. We're going to discuss a few things this evening. My plan is not to keep you too long, and hopefully it is just a review. For most of you, we have been dealing with this for the past 7 months, more or less. So hopefully it's a review. If you are hearing my voice, I am so happy that you are, because that means that whatever you are doing, it is treating you well. So I'm glad to see the faces that I can see, and for those of you that are joining by audio through phone, I'm happy to have you here too, so that we can go over some very important information. Again, thank you, Lady June, for having me. Um, Thank you, Jasmine, for fixing that there so I could share my screen. All right, so we're going to go ahead and get started. As Sister Palmer mentioned, for those of you that may have been on the call earlier, I believe that this screen did take residence on your screen. But again, I know we do have some people that are listening in just by phone, so maybe you're not able to view it. So I will go through. We do have to state this disclaimer. So this presentation is not meant to be a substitute for professional medical advice, diagnosis, or treatment. This presentation also is not to offer legal or regulatory compliance advice. Please consult your physician and legal professionals in the areas you have related concerns. Information discussed during this session is presented without claim to cure, treat, or guarantee against contraction or transmittal of COVID-19 or other illnesses. Prescriptive and supplemental drug recommendations will not be provided. Okay, so now that we have that out of the way, just to make sure we're all on the same page as far as our discussion this evening. All right, so Corona who, COVID what? What is this thing here? You know, we hear so many different terms being thrown around, so I do want to start with some basics just to make sure that we have clarity on what it is we're talking about. You know, it's like we woke up one morning and now we're dealing with this COVID thing. So what is it? You know, we're using these terms, but let's just break it down a little bit. I do want to make sure that everybody does have an understanding that coronavirus in itself, the virus itself, that's not anything new. It's a group of viruses that has been out there, but you may have heard it called novel coronavirus in us dealing with this COVID-19, because novel meaning new, it is new for humans. This particular strand has not been seen in humans. There are other coronaviruses out there that cause other illnesses that are, you know, in relation to severe acute respiratory syndrome, also known as SARS. We've heard of that before. But this particular one that we're dealing with, which back in, as far as we know, with the World Health Organization, what they're telling us is sometime between November or December in Wuhan, China, that's when the first case was seen. So they're calling it novel coronavirus. It was new, seen in humans. Okay. So now we have the World Health Organization, and there's a whole committee there, a whole group of people, and their job is to name diseases, name viruses. This is what they do, they study it, they come up with names. So this is how we get to COVID-19, because knowing that it was related to the group of SARS and coronaviruses, now they're saying, you know, this is coronavirus disease. So we have the virus that's causing the disease. So the severe acute respiratory syndrome, or coronavirus, is causing the disease, coronavirus disease. So that's how they broke it down into COVID-19. So for purposes of this presentation and as we move forward, I'm talking about coronavirus disease 2019, COVID-19, not mentioning any other thing, you know, that may have been caused by coronavirus. Okay, so just so you know. So again, World Health Organization, or WHO, is telling us that in China, maybe around November 17th of 2019, that's when the first case came about. And then here in the US, probably before we even heard too much about it, around 20th, to wear masks, we have to wipe down things, or the frenzy that went on with finding bleach and disinfectants and all of this stuff was maybe not until about March. That's why I say that, you know, we've been going through this change, this transition for about 7 months. So if you want to throw in January, then we'll say about 9 months, okay? All right, something else that I hear these words being thrown around, just to make sure we have clarity: epidemic versus pandemic. So yes, when you know, there was just a case in China and it was lurking around that area, we can say that it was regional, you know. So maybe it was an epidemic, but we're dealing with a pandemic, point blank period, right now. And as of March, or even when it reached the US. So epidemic versus pandemic. So when you're talking about an epidemic, that's something that's contained in a specific region. There may be, it may be a disease, a virus is jumping from person to person, but there's no permanent prevalence. Maybe it's lasts maybe a month or two, you don't see it anymore, but an epidemic can indeed become a pandemic. And that's what we're dealing with now. So this COVID-19 has gone from China, and it's touched all the continents, basically, okay? Not including, you know, the continent. So a global disease that spread across the entire country, continent, the whole world, all right? So as of March 11th, 2020, that's when WHO declared COVID-19 as indeed a pandemic. Quarantine versus isolation. I also want to talk about this a little bit too, because this is something else that I hear, you know, words being used interchangeably. And yes, in layman's terms, we can say that quarantine is just a form of isolation, but in us dealing with this virus and us dealing with this disease, especially in the medical world, isolation for us is a bit different, okay? So with quarantine, you probably have heard that over and over again. If you've listened to any type of media outlet, they've been having us to quarantine, stay in your homes, especially if you think you have been exposed to the virus, stay in your homes at least for 14 days, or if you're having symptoms until your symptoms disappear. So quarantine is basically separation of a person or a group of people when they're thought to have been exposed to a communicable disease. So there's no guarantee that they are positive at that point, but they can somehow maybe say they think they've been exposed, so they're not sure if they're positive. So that period of time where they're just, you know, staying to themselves, staying away from other people, that's what we're deeming quarantine, or people have been told to self-quarantine. However, when we talk about isolation, isolation comes with a little more, a few more strings attached. So in this case, these people are known to be positive. They have tested positive. We are isolating them. In the hospital setting, these people are in what we call negative pressure rooms. These people are positive. We also have what we call PUIs, patients under investigation. So meaning that they are most likely positive, but we're waiting for test results. So we keep these people separated. We keep them isolated. They are in negative pressure rooms, meaning that the air in that room is contaminated, but when the doors open, that air is not traveling to the outside corridors to then infect the rest of the population that has not tested positive. So again, these are our words: quarantine and isolation. So if you have not tested positive, if you have not been hospitalized with COVID, but you have been keeping away, you are what's, you know, what we call quarantine. You've been self-quarantining. If you've been doing all you can just to stay out of public places, be at home, you know, if you had to travel and maybe it was a possible exposure, or you have been told to stay home and you're not positive, that's just self-quarantining because maybe you had a possibility. So quarantine, we don't really know if they're positive or not. Isolation, they have been pretty much diagnosed, okay, as positive. Also with quarantine, I can say, or in a sense, when you test positive, not everybody has symptoms that puts them to be hospitalized. Some people test positive, and the hospital, they'll turn around and send them home and say, hey, go home, monitor your symptoms. And we're going to talk about symptoms a little bit later on in the presentation. But they'll send you home and say, just monitor your symptoms. As long as nothing gets worse, you're fine. You'll just have to, you know, fight it off. They may give you something to take to help you with the symptoms, okay? So in that sense, you are being self-quarantined, and you're also indeed isolating yourself because you have tested positive. So hopefully there's a little clarity there. I hope I didn't make it more muddy if it was already gray for you. All right, so as far as transmission, COVID-19 is primarily transmitted from person to person through respiratory droplets. So as information is still being collected about COVID-19, the data does not clearly state how long a virus can live on inanimate objects. So I know there was some frenzy about that too up front in the earlier months, like what should we be touching? Should we not be touching this? Is COVID still living? Is COVID-19 still living on, the grocery carts or the counter when I check out? We just don't know. And even at this point, 7 months into it, I cannot give you any definitive information as far as COVID-19 and its lifespan on inanimate objects such as countertops, such as telephones, such as doorknobs, such as the checkout counter, the ATM machines, because it just has not been around long enough, and the research we don't have definitive answers yet. So the best thing for us to continue doing is to protect ourselves and to disinfect when we can, wipe things down, which truly and honestly, these are things that we should do anyway. Even without COVID-19, we should be washing our hands and practicing safe practices, hand hygiene, just to prevent infection. Right now we are in flu season, as we say, and sometimes flu season can actually vary from year to year, just because the flu just is a virus, so it can mutate itself. So sometimes we see it hang around a little bit longer. So we may say, oh, it's going to be here between December and April, and then April comes and we may see more cases going, past April. So it's pinpoint and say this is from December 1st to April 30th, and that's it. We can't say that because we can have flu cases all year round, but it's just that at certain times of the year we may see a hike in cases. So this is why we need to maintain our precautions. And as I said, not just with COVID-19, but we should always be practicing proper hand hygiene, infection control methods. So with COVID-19, basically we've seen most of the research has shown that it's coming from person to person contact, not saying that, oh, this person leaned on the counter and now they got sick. However, when you are touching things that are touched by a lot of people in public places, you do want to make sure, again, that you are being taking proper precautions. Keep your hands out of your eye. We have a tendency to, want to scratch our eye, or, if we're driving and you had an itch in your nose and now you're digging in your nose, and now, you're talking to somebody, or we take, an ink pen we might be writing, and we take the cap of the pen and we put it in our mouth. These are nasty habits, people. So not just because of COVID-19, as I said, there are so many other germs out there that are actually harmful to us. And we just want to be careful of that, okay? So with the droplets, someone that has COVID-19, if they sneeze or cough or they're talking, infection droplets can land in the mouth, the noses of people who are nearby, and possibly be inhaled into the lungs. So this is where our mask wearing comes in, all right? Respiratory droplets can land on hands, objects, surfaces around people when they talk, touching their eyes, nose, and mouth, as I mentioned before. All right. And with the droplets, some of those people, they can actually test positive. And as I mentioned before, they can be asymptomatic. You can be asymptomatic and still test positive. And that just goes to show you the range of, illness that this disease can cause. Some people test positive and they don't have any symptoms at all, whereas other people test positive and they are deathly ill. All right, I see the whole gamut in the hospital. Well, mainly if they're hospitalized, they're very ill. As I said, we have some people that test positive and they're sent home and just told to follow up if the symptoms get worse. All right, so speaking of symptoms, symptoms versus asymptomatic. So some of the symptoms, if you have come in contact with the virus, symptoms can take 2 to 14 days past the point that you have been exposed before you even start feeling something. So some of the symptoms you see on the left side of your screen are fever and chills, and a temperature that's greater than or equal to 100.4 degrees Fahrenheit or 38 degrees Celsius, we deem that a fever. And this is the important term, fever, because you have some people call in or they show up to the emergency room and they're, oh, I have a temperature. Well, yes, we all have a temperature. If we're living and breathing and talking, we have a temperature. The question is, what is that temperature? So what we are concerned about is it a fever? So a fever, again, by the Centers for Disease Control and Prevention, the CDC, they deem a fever to be anything that is 100.4 degrees or above, okay? This is when you have cause for concern. Along with that fever, you may be experiencing a cough, shortness of breath, or even difficulty breathing. You may have a sense of fatigue, muscle or body aches, a headache, a new loss of taste or smell. So not saying that, you know, years ago you lost your sense of taste or you just don't smell for whatever reasons. This is new. So a new loss of taste or smell, okay? A sore throat that's just, you know, it's nagging, it won't go away. Congestion or runny nose, nausea and vomiting, diarrhea, conjunctivitis. This is a wide range. These are a wide range of, this is a wide list of symptoms. Okay, this can mimic, you know, other common things that we've gone through. If you're listening in and I'm going through this list of symptoms, you may say, hey, I've had this before and I know I didn't have COVID-19, or I've had this recently and I got tested and I was negative. So again, it just goes to show you, you can have this laundry list of symptoms and experience one, two, a few, or none and be positive, or you can be experiencing something from this list of symptoms and still be negative. So again, this is so new that we just have to, you know, take into account things that we see people coming in with that are positive. And this is how we create our list, because, all right, this person is positive and this is what they're complaining of. They tested positive and they have a sore throat. They tested positive and they have nausea and vomiting. And you'd be surprised. We talked about fever and chills and sore throat so much. I know people that have tested positive and they have not had any fever or chills, but they've had vicious diarrhea or nausea and vomiting. Then we have another group of people that they're coming in just with eye irritation and they think it's pink eye. And it may indeed be that, but it is thought to have come from the infection, the COVID-19, and they test positive for COVID-19. So there's just a lot of symptoms to be aware of. Apart before you are cleared to return to work. With that being said, I do also want to say that many people, especially with healthcare workers, because early on there's some bias, you know, some people not want to be around healthcare workers, people getting, you know, fussed at, or, you know, when they're in the grocery store and they have on their scrubs. But the thing is, a lot of healthcare workers, because we know the cases that are positive or if they're under investigation, we have measures in place where we are protecting ourselves. I have seen people that are tested positive, but they have not tested positive from working around COVID-19. They've tested positive simply from being out and about or around family members or friends in gatherings that you don't know what they're doing, or these people don't have the same strenuous practices in place that we do as far as protecting ourselves when we are in the healthcare facility. So I'm saying this to say, don't be afraid of and don't run away from healthcare workers when you see us. All right. All right. So emergency and reporting to the ER or calling 911. These are the times in which you should do this, are especially if you have trouble breathing, any persistent pain or pressure in the chest, any new confusion, or an inability to wake or stay awake. Also, if bluish lips or a bluish face, this is a very late symptom of an emergency, but this is showing that there's a problem with gas exchange, with there's a respiratory issue going on here. So definitely, hopefully none of us have to experience this, but just so that you are aware, and you can pass this information on to your friends, sisters, cousin, next door neighbor's uncle, to let them know that these are reasons that we need to, these are emergency situations, okay? All right, so as far as testing, there are two types of testing that you may hear about. Viral testing is the main one that we've been seeing, and this will let us know if you have a current infection, all right? So this is what you see going on at your testing sites. This is what you see going on in your local hospitals, the viral testing. We're trying to see if there's any viral shed, if you are indeed positive. The other thing to keep in mind is that if you think you were exposed yesterday and you go get tested today, or tomorrow, your test could come back negative. However, remember I mentioned before that symptoms can take as long as 2 to 14 days. You may not be feeling anything, and that just means that at that moment you were not positive. But you just need to be aware that if you do start feeling symptoms, you may need to have a follow-up test. And if you were to go to a testing site, they will give you this information as well. And again, you always want to follow up with your physicians and make sure that they know what's going on as well. An antibody test might tell you if you have had an infection in the past. Now, these are a little harder to come by. You don't see the drive-through antibody testing going on. It's more so viral testing that's going on. We want to see if you are testing positive for COVID-19. Now, as far as antibody testing, I know that in some sites, if you were to go and donate plasma, along with that donation, they can test to see if you have antibodies, which would then tell them that at some point you were exposed to the virus. And then, they were using plasma to help along with the recovery of some of the positives and the more sick people that were hospitalized. All right, so those are the two names that you'll hear: viral testing versus antibody testing. And who should get tested? Should everybody be trying to run out and get a test? Not necessarily. Some people do it for peace of mind, because they've been exposed and they want that peace of mind just to know, hey, I'm negative, or if I'm positive, what should I expect from that, So people who have symptoms of COVID-19, if they're experiencing anything in that laundry list of symptoms we went through on the previous slide, of course, those people should get tested. Or if you've been in close contact with someone who has a confirmed diagnosis of COVID-19, or maybe you didn't know at that time and they were nice enough to contact you later and say, hey, I tested positive, you may want to go get checked out, especially if you were less than 6 feet from them for 15 minutes or more and you were not wearing a mask. Maybe you were in close contact, with them, physical contact, you want to get checked out. Also, there are some people that have been asked by their healthcare provider, their primary care provider may want them to get tested based on some symptoms that they have showed up to a visit with, or maybe they're doing telehealth visits now, and maybe they did a visit and they're just concerned. So the healthcare provider can suggest it, or in some cases, an employer may suggest it because they have a known positive case and they seek out. We see people like this too, where they come in, they want to test because an employer sent them, because somebody in their job has tested positive, and they seek out the people who have been around that person. You may not even know the identity of that person, but they know that at some point you had contact. So they want you to be tested just to see if you are positive or not. Because of the fact that this is the Florida jurisdiction, I know I have people that may be listening from different counties. We're not all in the same places. So I don't have any specific testing site information posted here because it's going to vary from place to place. Early on, we had different testing sites and there's different criteria that you need to meet. Some places were only testing you if you were symptomatic. They weren't testing you just because you wanted to test for peace of mind. There were other places that were. Some places had criteria. You had to be in a certain age group. So you need to check your local listings to find out the testing sites where you live. Check out the hours of operation and if there are any specific testing criteria that you must meet. Also, if you need an appointment, some places were walk-in only, or some places were drive-up only. So city websites, do not discount your city websites. I really encourage you to get involved in your city website, whatever city it is that you live. Check out the city websites because they often put updates. Also, you can enter your emails to get information from your city. I check my city website. I have my email there. That way I get information about what's going on. I know when testing sites are popping up. If there is a food drive going on, my city has even had a mask drive. You drive by and they just throw the mask in your trunk for people that need masks. And that's information that we can pass along to one another. Remember, information is not so great if it just stays with us, but we need to be able to share with one another. That's how we help one another, and we're better when we're in this together and passing along information so that everybody stays knowledgeable. Also, your county health department websites, okay, whatever county you're in, you should have a health department, hopefully. Or if there's if you're a smaller county, maybe there's a nearby county that's governing your health situation. So you want to check out the health departments, your local health departments, to see what type of information that they are offering. These are going to be your go-to sites to find out the most up-to-date information. The CDC website is great, but it's not going to have information about your local situation. Okay, you have to understand what's going on in your area via your city websites or your county health department websites. All right, so with that being said, if you're like me, I like to see, all right, you can tell me all of this, but it's still real, you all. Even though, things are opening up now, we have the malls open, we have your restaurants are opening back up. Grocery stores, I don't think they ever closed. They had limited hours, but basically I know down here in Broward County, Dade counties nearby, we're pretty much open again. But that's not to mean that you should be relaxed on your precautionary measures. So just to look at the numbers, and I have, for those of you that can hear me, that's awesome. I'm going to be going over some numbers. For those of you that can see the screen, I have the websites posted there because you can check those out yourself for people that are interested in numbers. Some people don't want to talk about the numbers, but I like to see really what's going on and what the trends are. What's the decline? What's the rise? What are we looking at over the months? So again, we're talking about a pandemic. So this first slide that I have here, statistical data, is going to show what's going on worldwide, and then we'll break it down to the country, and then I'll hit on a few of the counties. So here we have usafacts.org for those of you that are listening in, if you can't see the screen. So it's usafacts.org and covid.cdc.gov. There's a data tracker there that gives you information. They usually update it every couple of days. You have to realize that this information changes rather quickly because testing is still going on. We have people that are recovering. We have, unfortunately, people that are passing away from this, as we know. So the numbers are going to be changing rapidly. So sometimes you look, this data that I pulled was about, I believe, a day or two ago. When I checked again last night, it had not really changed that much. So those are the websites, usafacts.org and covid.cdc.gov, COVID data tracker. All right. So worldwide, we have a total of 42,075,568 cases of COVID-19. I will say that again. Worldwide, there are 42,075,568 cases of COVID-19. Our population worldwide is 7.7 billion, approximately. These are, of course, with population, we have to go a year back because we're still in our current year right now. We don't have all the numbers in, but 7.7 billion people. So out of that, we have 42,075,568 impacted or tested positive for COVID-19. Out of that, worldwide, we have 1,141,775 that have passed away from COVID-19. Okay, so that's worldwide. Now let's look at the US. The population in the US, remember the world's population, it was approximately 7.7 billion. The US's population is approximately 328.2 million people, all right? So out of our US population of 328.2 million, we have 8,263,362 known positive cases. Again, that's 8,263,362 known positive cases. That is up, as reported on October 21st, that was an additional 60,515 from the previous report. As far as people that have passed away, unfortunately, we have the numbers for the US is 220,061 deaths from COVID-19 to date. And let's look at Florida because this is where we are. Most of us are here in Florida. So when we look at Florida, our population here is 21.48 million. Out of that, in Florida, known cases are, there are 768,091 known positive cases. And deaths, we've had in Florida 16,267 deaths. Okay, it's a really sad situation, the way this COVID-19 is impacting us. All right, so I'm going to go through a few counties now. As I said, I know we're listening across different parts of the state. I don't know where you are. I may hit on your county, I may not. Again, the websites are there if you want to look it up, if you're interested in knowing specifically what's going on in your county, and if I have not mentioned it. and you're interested in seeing that. So in Miami-Dade County, we have 179,644 known cases with 3,572 deaths. In Broward County, we have 81,704 known cases with 1,519 deaths. Palm Beach County, 49,380 known cases, 1,553 deaths. Hillsborough County, 45,948 known cases, 755 deaths. Duval, we have 33,260 known cases, 512 deaths. Orange County, Florida, 44,112 known cases, 533 deaths. Volusia, 12,080 cases, 315 deaths. Martin County, 5,201 cases, 164 deaths. Monroe County, 2,101 known cases, 25 deaths. All right. So that's just a little bit of the data, just to, you know, for people that are into numbers, so you can see what's going on. And just to remind you that that is recent data. I'm talking October 22nd. So we still have cases going on. It's just a reminder to do what you've been doing. If it is working for you, definitely this is not time to relax on your precautions. That's why I wanted to show you the numbers, so you can see that it's not like we don't have a zero number of deaths. We don't have zero number of cases. We are still in the multi digits as far as the deaths, as far as the cases that are continuing to hit our country. So we need to be aware, we need to be vigilant, we need to make sure that we are protecting ourselves. All right, so as far as protecting ourselves, what are we supposed to be doing? I mentioned before that hand hygiene is everything. Oh, it's everything. We learn and we know in the medical field, and I can't encourage you more. I can just repeat it over and over again. Washing hands, it saves lives. It helps, you know, to decrease the spread of germs. Beyond COVID-19, there are so many other diseases that are out there. There are so many other bacterial infections, viral infections that can be passed just from dirty hands. So hand washing is everything, all right? We want to wash our hands before coming in contact with our eyes, our nose, our mouth. We want to wash our hands after coughing, sneezing. Even if you're using a tissue, or some people like to cough in their arm crease, that's great, but you need to wash your hands. And then when you wash them, make sure you get up to that arm crease too, because that's a contaminated area now. And now you pick up somebody's baby and they're sitting in the crease of your arm that you just sneezed the cough in. Not good. So we need to cut down on the passing of the germs, right? We want to wash our hands after coming in contact with public frequently touched items. So door handles, carts, ATMs, gas pumps, your car steering wheel, your car door handle. I like to wipe that stuff down, you know, periodically. And when I come in the house, I'm washing my hands and make, you know, even if I didn't touch anything or I just sanitized when I got in the car, when I come in the house, I'm going to wash my hands. I want to repeat to you, hand washing is everything. Now, the use of hand sanitizer, that's fine too. But hand sanitizer is the option when hand washing isn't available, okay? Or if hand washing isn't an option. If soap and water is not an option, if you have hand sanitizer with you, that's great. So CDC recommends that we have 60% alcohol content or better with our hand sanitizers. But again, I will say, if you can get to soap and water, that's going to be the best thing for you. Why do you say that? Well, this is why. So with soap and water, when we're washing our hands, we are creating friction, right? We are creating friction with soap and water. And also we're rinsing off any bacteria or any germs, any microbes that may be there that we can't even see. Versus with hand sanitizer, yes, it's killing some germs. And I say some because we don't know what all you've been exposed to, and if the hand sanitizer is indeed effective against that particular germ. Versus with hand washing, you've washed them away, you've scrubbed them away, and you've rinsed them off. So they're gone, it's bye-bye germs. Hand sanitizer, even after using it so many times, you will start to have a film or a buildup, especially depending on what type of hand sanitizer you have. A lot of them have additives in it. It's not just simply alcohol. Some of them have fragrances in them. Some of them have aloe in them, some other type of emollients in them that they can cause a buildup. So it's even good after so many uses of hand sanitizer that you go back and you wash your hands. I, again, just want to encourage you, soap and water, that's going to be a great thing, okay? Also, here lately, you want to check the FDA.gov website because there had been some recalls on some of the hand sanitizers. It's kind of weird, you know, at first we had trouble finding hand sanitizer out there. Now hand sanitizer is everywhere. There's companies making hand sanitizer that, I don't know, they just entered the world of hand sanitizer a few months ago because they never made it before. Just people that you never thought would be making hand sanitizer, they are making hand sanitizers. So you want to be, you know, careful about what you are buying and make sure that you are checking out the website for any recalls. Many of the those that were recalled is because they were labeled as having ethyl alcohol, which, you know, most of hand sanitizers have some type of alcohol content. However, when they were tested, FDA is saying that they found methanol contaminants there, which can be harmful if ingested. So hopefully there's nobody out there drinking hand sanitizer or taking it in, but there have been cases in the past, even pre-COVID-19, where we had people that were actually drinking hand sanitizer. You'd be surprised what people do when they want alcohol and to try to get to it. So in this case, with some of these hand sanitizers that have been recalled, if somebody was trying to take it for a recreational purpose, they may find themselves on the other side because of the methanol content. So again, just be careful about what you're buying and make sure it's from a reputable place or company. When you're using a hand sanitizer, you want to make sure that you're rubbing the front and the back of your hands and between your fingers and the tips of your fingers until they are dry. It's not effective to, you know, wet your hands with hand sanitizer. Now you're touching everything else, or you take a paper towel or a napkin and you wipe it off. You need to give the sanitizer time to dry. The same thing is when you're using disinfectants. You need to have it has a dry time. The dry time is usually the time that it takes for it to be effective against killing whatever source of microbes you're trying to eradicate. All right. Okay, so again, we want to disrupt the spread. We have been told to wear a mask. So the purpose is defeated if the mask is not being worn properly or if it's ill-fitted, okay? There are different types of masks. I will say that not all masks are created equal. I'm gonna try to go through a few of the masks, and maybe I've listed some here that you've heard of. You may have heard of some other ones that I won't talk about. But again, if there's any question about it, we'll have time to ask about that, okay? So there, CDC is telling us that wearing a mask can decrease, excuse me, if wearing a mask improperly can decrease its effectiveness by as much as 60%. So you can have on a mask, but if it's not on right or if it's not fitting right, you are exposing yourself. So it's just as bad as if you did not have on a mask at all. All right. So there are a lot of different cloth masks that are out there. And the good thing about it, if you have some that are 100% cotton, they're saying, is a good source of a cloth mask just because at its structural level, it's a 3D structure. So that means that the weaving of the cotton is like 3D at a microscopic level that we can't see, but it's 3D. So meaning that it's going to be harder for particles to pass through those woven areas of the cotton. Versus if it's a thinner synthetic material, it tends to be smoother at the microscopic level. It tends to be smoother, and it's going to be easier for large and small particles to pass through. So if you do have some masks that are made of a thinner material or synthetic material that's not cotton, you're going to need more layers. Okay, so just a one layer, and especially if you hold it up to the light and you can see through it, the more transparent it is, the more likely that it's not providing you with a lot of protection. Okay. Also, daily cleaning. It's nice if you've been able to get a hold of more than one mask. That way you don't have to continue putting on the same mask day after day after day without cleaning it. That way, if you have one that you've worn today, you can clean it and then have it set to dry, and then you have another one that you can put on. By the time the next day comes, that one that you cleaned before is dry and ready for you to use. Because of the fact that we're being exposed to, you know, microbes that are out there that the mask is catching. And also, you know, you're breathing into the mask. We do breathe out bacteria. We carry our own bacteria with us. So you just want to keep that clean, because if you continue placing a dirty mask back on your face over and over again, eventually you may have some ill effects from that. So you want to make sure you keep it clean. Also, if you're hand washing the mask, you know, a little mouth soap and water is fine. You want to make sure that they dry completely, because if they are not dried completely and they are wet, that gives the opportunity for bacteria to harbor there, and bacteria can lead to more infection. So that's a whole nother issue. All right. Also, some masks come with little openings on the back, like this one that I have here, if you can see. And it's just a space for you to be able to put a filter in. Now, these filters can also be purchased separately. And I'm not saying that you have to have it. You do what makes you comfortable. I have a couple of different types of masks. Like I said, I just want to show you. But you have some people that are, all types of people are making masks now. And you have some where they have slits in the back. I have another mask here that does not have a slit in the back at all, but it's a couple of layers of material. So it's, you know, providing good protection. But when you have the slit, you're able to put a filter in there. If you don't go online and find your own little filters to place in, I've seen some researchers are saying that you can do like a couple of layers of toilet paper inside the mask. I've heard all types of things. People are using coffee filters to put inside their mask. Somebody told me they were using a panty liner to put inside their mask. Like, people are using all types of things. What you need to make sure that you are able to breathe. You don't want to cut down the breathability of the mask, because that's going to cause you issues and it's going to make you less likely to wear the mask. Also, just back to breathing basics, we expel CO2 and we try to breathe in oxygen. So if we have a mask that's occluding our breathing too much and we're keeping in too much CO2, you could start feeling effects from that, such as headache or so. So we want to be careful from that. Also, there are some filters that are polypropylene filters. If you see those for sale, they're saying that that's good because it helps to prevent passive particles because of a static sensation, like electrostatic, sort of like when fibers of some of your clothes, you see certain things you put on, it has more static than others. Cotton doesn't tend to do that, but a lot of synthetic fibers usually do that. But with the electrostatic charges, it helps to trap the particles in. All right, this type of mask here, this is another one where there's an opening for a filter to slide through, which is great. However, I want to draw your attention to this valve that's on the side. There are a lot of masks that have this. So with this valve, we talk about breathability. So this is going to allow you to breathe, you know, a little easier, because when you're expelling air, it's going out easy, just as if you didn't have it on. However, if you are infected and you're around somebody that does not have on a mask, they're not protected, because it's your air that's coming out of this little valve that's here. So we want to be mindful of that. One thing that I can tell you that we can do, if you just have your valve mask that you're breathing out of and you can't get anything else and that's what you have, and if you know you're going to be around somebody, like say an infant that can't keep on a mask, or a vulnerable older adult that can't keep on a mask, and if you're just around them for a short period of time, you want to help protect them, you can always double mask. So if you put this on like such, you can also take a surgical mask and put that over so that this valve is covered and that air is not escaping from it. So that's just an example of how we use these. I'm not telling you that you can't use your valve mask, but I just want to let you know that if you're around somebody that does not have on a mask, your air is escaping through this little valve that's there. And they've made it, so you say, well, why do they make them like that? Well, because it's a little easier to breathe, right? So cloth masks are really what the recommendation is from the Centers for Disease Control and Prevention for the layperson to walk around with. And we try to reserve our N95s, our KN95s, our P100s for the healthcare worker, all right? So some of you, if you're not even in healthcare, you may have gotten a hold to an N95. There are people that are walking around with them. If you have that, and again, the CDC is saying that, you know, with healthcare workers, we are in a more saturated environment where we may be around positives. So we need that type of protection. And at one time, you know, there just was a shortage of N95s and we weren't able to get them. So they would rather see people that are not in the healthcare field to wear the cloth mask, or if you can put a bandana or some type of cloth covering around your face, versus using the N95s and to reserve that for the healthcare worker. So just to show you a couple of N95s, and if you do have them, again, if it's ill-fitting, if it's not fitting you properly, it's not doing the job. And this is another reason why really it's reserved for healthcare work. It will work, of course, but you want to make sure that it fits properly. So there are two sizes, and people probably don't even realize sometimes. So on this particular one, and which I can't wear this to work because it is vented here. They provide us with our own there. But if I did, I would have to cover it with this just to protect those on the outside of me. But on this is one that's by 3M, and it says N95 here. It says, it doesn't have an R behind it, but sometimes you'll see an N95 that says N95R. That R is for regular. Then this is another one by 3M that's not vented, and it says N95. It's an N95, but it has the number here and there's an S behind it, and that's for small. So this one in particular, I wanted to show you this because this is ill-fitting for me. It does not fit properly. And another thing, I want to make sure that if you have a mask that has these two straps like this, I've seen people out and about that take this mask and they turn it this way and they put it around their ears. That's not how it should be worn. That's not providing you with great protection. This mask has a little wiring at the top. This fits over the bridge of your nose. These two strings here, one should go at the base of your neck and the other should go toward the top of your head. This is a great example that this does not fit me. It's too small. If you see here, my face is gapping on the side, it's not fully covered. I can barely breathe in it. It's fitting too close to my mouth and my nose. And you can't really look at a person and tell, oh, they should have a small or they should have a regular. So we're out here and we're just getting mad, so I got an N95. Well, I see people, they have on these N95s and the strap is just hanging. It's not providing good protection for you. If you are going to wear it, you need to wear it properly. If it has two straps, it's there for a reason. If it has two straps, it's there for a reason and it needs to be worn properly. This one fits me better. This is the regular size. So this is going to cover the bridge of my nose and under my chin. I'm covered on all sides. I know I'm protected with this. So again, this one is going to go at the base of my neck. It's not sitting on my hair. If I'm putting it on properly, I'm going to make sure it's under my hair. So let me just go ahead and demonstrate the whole thing. So this needs to be sitting at the base of my neck, and this piece comes to the top of the head. I then feel around the bridge of the nose and make sure that I am securing this metal piece or the little wire piece in place so that it's secure, okay? We actually, as healthcare workers, we actually get fit tested for these masks, and they put a little thing around our head and they spray something and ask us if we can taste, if we can smell, to see if it's working effectively. So the layperson, if you're not in healthcare, most likely you have not been fit tested for the mask. So again, I will tell you that you can blow around it to see if air is escaping, but it's without, what they do with the measures that they take us through, you haven't been fit tested. Again, it's your choice if you choose to wear the N95 or not. Also want to talk about numbers. So the number N95, the respirator, and then you see KN95. The KN95, we started hearing about that this year because we were running out of the N95s. So the KN95s is a product that came from China, and it's approved by their governing agencies. It's not approved here by our governing agencies, which is NIOSH, the National Institute of Occupational Safety and Health. That's who tells us if these masks are good for us to wear or not. But because we were running out, they started using KN95. So some research is saying that, okay, the KN95 is just as great, but I will tell you, as a healthcare worker, we were not allowed to wear them. We had to wear the N95s, which they did provide for us, although, we had a limited amount. If you see something that says P100, so the 95 just lets you know that you are being protected from 95% of the particles that you may come in contact with. The P100 is letting you know that you are protected from as much as 99.8% or close to 100% of the particles that you may be coming in contact with. Also, just like we have multiple companies making hand sanitizers now, there are a lot of people out there making different masks. So you want to make sure that you're not getting a hold to a counterfeit product. And how do I know that if it's a counterfeit product, you say? Well, if you grab it and it's falling apart, or you grab it and you can't breathe through it at all. You should be able to breathe, okay? It shouldn't be falling apart as soon as you put it on. So that's telling you that something's going wrong with that. You'll be better off just tying a bandana around your mouth or a scarf or some piece of cloth around your head versus using a faulty mask that's providing you no protection whatsoever, okay? All right, so with our healthcare workers, we want to talk about, I've mentioned to you that we are going to be more exposed to, you know, a saturated, in a more saturated environment, people that have tested positive and they're known positive. So that's why we've been trying to conserve our PPE, our personal protective equipment. Also gloves, face shields, goggles, and I do have a slide just showing different pictures of those things. I see people out here with gloves. Okay, if you want to wear gloves, that's great. But I do encourage you, again, you have to wash your hands. I see people, they have on gloves, they have their hands in their pocket, they're scratching their face, they're touching all types of surfaces. Like, I don't know if they think the gloves are giving them some type of superpower to just protect them from everything and they just can throw out the window what they're touching. But if you choose to wear gloves, you want to make sure that you are still using proper precaution. When you put on a glove, especially, and when I'm out, when I'm working, of course, I have on gloves, I'm dealing with patients. But when I'm out and about, I'll be honest with you, I don't wear gloves. The only time I may wear a glove, it makes me feel comfortable when I go, and it's my own comfort, just like I'm telling you, your own comfort. You do what makes you feel comfortable, okay? And if you know you've been doing something that's been working for you, you have not tested positive, you feel great, do it, okay? For me, when I go to the gas pump and I use one hand, I know how to keep that hand, like this is gonna be my dirty hand. This is the hand I have the glove on. This is the hand I'm touching the gas pump with. I'm not touching my car. I'm not touching my my card when I stick it in to pay for my gas. This is my dirty hand. I'm only touching the pump with this. And when I'm done with that, I am going to remove the glove and I toss it in that trash can that's right there by the gas pump. I don't touch my door handle with it. I don't touch my steering wheel with it. And I'm telling you, I've seen it, and I know many of you out there probably have seen it too, with people that have gloves on and they're just touching any and everything. Maybe even they're touching you. So you have to be protective of yourselves as well. Watch people when they have on gloves. And again, it's not wrong to wear gloves. Just be cognizant of the things that you're touching. You shouldn't be scratching your eyes, your face, your nose, putting your hands in your mouth, scratching around your mouth when you have on gloves, because just like with your hands, when germs can get on it, you know, when you remove gloves, you should still be washing your hands. In healthcare, we're told that we use hand washing before, or hand sanitizer before putting on gloves. And once we take them off, we have to wash our hands or use hand sanitizer when taking them off as well, okay? So here's a nice little visual just to, and I showed you some masks that I put on, took off, but here's another nice little visual just so you can get an idea of some of the things that are out there. I'm running my mouse over here. If you can see, this is the surgical mask. This is commonly used. If you've gotten a hold to these are great. Also, they have different layers. So those layers provide, you know, added protection. And here's your cloth mask, this black mask that's here. Your cloth mask, many of you have those. This right here is like a whole scarf. It protects your neck, your face. It comes up a little bit above the nose. And, you know, there are different types of masks. I mentioned the P100, and that's what this filter is. This right here is a elastomeric mask that we actually use in the hospital setting. So when I'm in a COVID, in a positive room with a COVID patient, this is what I have on. It looks like a gas mask, but this is a P100. This is what they have us wearing because it is protecting from about 100% of anything I can come into contact with, all right? Just as I mentioned though, with the mask that's up above it that has that valve where the outside air is coming out and we're not protected, now they actually have us putting a surgical mask over the front of this P100 filter, because the front of it, the filters are on the side where you see these purple stickers, but on the front of it, there's still air that's being expelled from me. So I have to cover up with that too. The mask to the right is also an N95 mask. It's just by a different company. So we call this a duck bill N95 because it looks like the bill of a duck. Then you may have some masks, and if you have children that you've been taking out, you have masks that have face shields connected to them. Some of you may have found your own face shields, and that's great because guess what? You're protecting your eyes. Remember, we talked about keeping germs from your eyes, your mouth, and your nose. So a mask alone, if you feel comfortable, that's fine. But if you feel like you need to wear a face shield, that's fine too, because you're protecting your eyes, which can be indeed another portal of entry. Or maybe with you having some type of goggle on or safety glass on your face, it may help you to remember not to rub your eye. So again, I'm gonna say these are just options that we're talking about. These are some of the CDC recommendations, but you have free will to make your own choice of what's comfortable for you. All right, so with disrupting the spread, we want to disrupt the spread. I want you to keep these things in mind. Your favorite places may be open, but so is COVID-19. It is not closed for business. I mentioned before, we have the flu that's still going on. We want to make sure that you're performing hand hygiene very often. You want to wear your mask. Stay home if you're not feeling well. This is the thing that some people have difficulty with. Maybe you've seen it in some of your coworkers. These people will come to work sick. And I'm not saying they have tested positive with COVID-19, but they're sick with something. So at this point, most of us, we definitely don't want COVID-19, but we don't want the common cold either. We don't want the flu either, or anything else that they're trying to share when they come to work sick. So it's nice if they just stay home, but we have to keep this in mind for ourselves. And if we're listening, maybe this is something that we're already doing. It's not for us, but I told you before, the information is no good if you're keeping it to yourself. Share it with others. Encourage others to stay home if they're not feeling well. Also, when you're getting ready to go out, these stores are open. I suggest that you make a shopping list, have a plan already in mind, check your store hours. Do not treat it like a day at the museum. Time out for the, that's over when we used to just, go to the mall and browse and spend hours and hours on the sales racks doing, just looking around. We need to cut down our exposure. So if you know that Publix opens at 7, if you can get there at 7, get there at 7. Have your list, be in and out. That way you are decreasing your risk of exposure. I know everybody's not able, maybe you're not able to drive, maybe you're not able to get out. This is when we have to look out for others. Maybe we can run an errand for a more seasoned adult or somebody that's not able to go like we are, or maybe they're immunocompromised. They're dealing with some other type of illness, so they don't need to be out and be exposed. So just, check on it. Just make a list, have a plan. It makes it a little bit easier so that you're spending as least time as possible around and possibly being exposed, okay? You want to avoid crowds, continue to social distance. There are, and I see people ignoring them all the time, and I think just because we're just so used to walking into a store and going down the aisle. But the next time you go in the grocery store, Publix namely, I know Publix has it, that's where I choose to go. People shop, everywhere, wherever it is you go. And they may have like little stickers on the floor that has an arrow to say, enter this way, or, do not enter. That's just to keep the traffic down on the aisles. But people are just not paying attention to them. They're there for a reason, okay? It's nice if we just are open about the changes that are taking place and that we can kind of, adhere to them, because it's helpful for all of us, all right? You want to limit, if being in a crowd is unavoidable for you, depending on whatever it is you have to do, or whatever it is, wherever it is you work, you want to try to limit your exposure. Where I work, it's unavoidable for us to not, I want to say crowds, but like as far as being in a room where there's 10 people or less, sometimes we can't do that. When we're sitting at the nurse's station, we are in close comfort, in close distance of one another. So they've told us that because of that, we have to, make sure we're wearing our eye protection and our mask, even when we're not around positive patients. We're still protecting one another, okay? And see how it is, I just had an itch. It's so easy for us to just scratch in our face and to do whatever. This is what we do. So we just have to be cognizant of these things. Also, disrupting the spread. Stress has a negative impact on immunity, all right? We want you to eliminate stressors as much as possible. If you have stress in your life that it's controllable stress, or if you're stressing over things that you really can't control anyway, that are not going to change based on you and what you do, you need to let it go. Because stress is releasing when we're stressed, and some acute forms of stress or short-lived forms of stress, sometimes it's good. It gets us motivated. We're doing what we need to do. That whole fight or flight syndrome, that's great. But I'm talking about here chronic stress that's bringing us down, that has us depressed, that has us, just not feeling well. And when we are stressed out, our body does react physically. So whatever we're going through mentally, it can manifest in a physical way. And one of those ways is to bring down our immunity. So we don't down immunity so much because of stress. So if you can eliminate it, and you pray about it, meditate, just whatever it is, if it's some person, if it's something, if it's some job, if it's something that you can control, you want to cut it out. All right. Also, I say goodbye fear. You are not welcome here. That fear. There are many people that are suffering from chronic illnesses, all right? Whether it's hypertension, diabetes, chronic heart failure, cancer, rheumatoid arthritis, any respiratory illnesses, asthma. This is something chronic that you have been dealing with. And I hear it and I see it, because by the time they come to us, they are sick because they were afraid to go to the hospital. Do not be afraid. We are taking precautions, all right? We're 7 months into this. We are taking precautions. We're cleaning. We are disinfecting surfaces. We are separating patients when they come in. We know who's positive. We are testing people that are admitted. We have measures in place. Most places have measures in place, whether it's your doctor's office, your local hospital. You need to make sure that you are keeping up with your appointments, consulting your physicians, especially if anything changes in your health. Please do not let fear take over you and you're sitting at home getting more sick, okay, without being seen, because it's not a good situation when you walk into the hospital and you're already critical. That's going to put you at more risk, all right? Hospitals are testing patients and isolating them as necessary, all right? Missing appointments can lead to an exacerbation of an illness that's going to make your situation worse because you decided to go get checked out too late. So I just want to put that in your head too, for any of us out there. If you know somebody that's dealing with a chronic illness and they've been afraid to go get seen. Then you have some doctor's offices that are doing telehealth visits too. So just keep up with your appointments. All right, so we've been commanded to love thy neighbor, right? So when you wear a mask, you lessen your risk and that of those around you. You want to be considerate of the vulnerable populations, the seasoned populations, the immunocompromised, people that are going to be at higher risk. I mentioned some of those chronic illnesses that people are dealing with. They're at higher risk. So we want to make sure that we're protecting them by wearing our masks. That helps that we're not breathing on them. Again, we can be asymptomatic. We don't know if we're carrying the virus or not. When we're shopping, also think of others, that person that can't get out to the store. Or if you know you have all of your disinfectant, but somebody else might need some, or you see something, pick something up for them. If you know there's a food drive going on or a mask giveaway going on, think of others. We are all in this together. We're better when we're doing things together and helping each other out. Also, you want to stay ready so you don't have to get ready. And I've heard our bishop say this before, just like we know hurricane season is coming, don't get in a frenzy and you're trying to find water and there's no water on the shelf. If you have this stuff all along, or like I said, if you go to the store, if somebody thought about you, they bought you a case of water, or you go, you get some at a time and you have it at your home, you're ready, right? Also with these wipes, people have been going crazy. I can't find Clorox wipes, or I can't find bleach. And now things are starting to become more plentiful on the shelves, but I promise you, it's okay to improvise. You may not have any Clorox wipes or Lysol wipes, but maybe you have a liquid disinfectant in a bottle. Take a little Ziploc bag, put you some paper towels in it, pour some of that disinfectant there. That way, when you go out, if it makes you feel comfortable to wipe down the grocery cart, you have your little paper towel with your disinfectant that you poured on there. No, it's not Clorox wipes, but it's probably just as great. Read the back of it, see what it's protecting you from. So don't get all caught up in this. And that's another thing that has stressed people out, just being in quarantine, not being able to find what they need. We don't need that, okay? There are other options. You also want to adhere to the guidelines that are set forth in your churches as you return. Some of the churches have already opened. Some of them are getting ready to open. Some of them are opening in stages where only certain members are returning back, certain auxiliaries or so forth. But whatever is there to keep, everybody safe, please adhere to that. Please let's not have attitudes about what's being told to us, if our temperatures need to be checked before we go in, if we need to sit distance apart from people, if there are some people that don't want you hugging them or touching them. We are still all in this, and some people are going to have, varying feelings about this whole thing. So we just want to respect one another. You want to stay informed and pass along useful information. I cannot say that enough. Explore the CDC website. Just as I went over numbers earlier, that information is out there for you if you are interested in that. Remember your city and your county websites, any mask giveaways, food giveaways, pass on that information, okay? And most of all, and through it all, we must continue to pray. We have to humble ourselves and pray. We have a spiritual responsibility, and everything I just talked about prior to this, that is our natural and our practical responsibility that's going to help us be safe here while we are here. We are here. We have, responsibility. We have to help each other out. But most of all, and through it all, people of God, we have to pray, okay? And these are some references. Everything that I've gone over here, this is not information that was just for me. This is public information. So you can visit the Centers for Disease Control and Prevention website. You can visit the World Health Organization website just for you to get more information. I hope that I've said something here that can help you. If you say, hey, I know all of this already, that means you're doing great. Keep doing what you're doing. But there's somebody around you that you may need to share the information with, and I hope that you will. I pray wellness over everybody that's listening, and everybody have a good night. Thank you, Jasmine. I'm going to turn it back over to you.
Thank you so much, Roshanda Nurse Henderson. We thank you. This information was pertinent, excellent, well put together, and very informative. I want to open the floor just for a moment to take maybe one or two questions. We won't be able to address everyone's questions tonight, but if there's anyone who has a question, I want to take just a moment to address those questions. I also want to, while you guys are gathering your questions, and I do see one from Sister LaWanda Hill, I want to just let you all know that this session is being recorded. So I will make sure that I get it to you all so you guys can go back and review anything that you may have missed, or just go over some things, some information that you want to refresh yourselves with. Okay, so Shonda, we have one question here from LaWanda. What things can we eat to help build our immune systems? And anyone else, if you have any questions, feel free to type them in the chat as she addresses that question. Thank you.
Okay, that's a great question, LaWanda. Thank you for the question. It is a bit of a loaded question because, as I mentioned previously, I don't want to get too much into because even if I'm talking about foods, it's kind of prescribing or recommending something, and I don't know everybody's situation, what they may be dealing with, any allergies that they may have, some people are dealing with diseases where they are immunocompromised, and some people have autoimmune diseases where their immune system is already heightened. So doing stuff to boost it can actually place them in a state where that disease is actually made worse. So I have to be careful about, what I'm saying there, especially, publicly. So I really want to refrain from talking about any specific foods that we may eat. That is a question that is definitely reserved for a physician whose care you may be under, that can tell you, based on your condition, what are some things that you can do to help boost your immunity, whether it's through supplements like vitamins, or we can get a lot of some of the vitamins that we need for our system through foods that we eat. And there are indeed some foods that are out there, but again, I just don't want to get too heavy into specifics, because what may be good for you may do some harm to somebody on the other end.
Okay, thank you. That makes sense. This question also may be a little specific, so you can address it how you see fit. Is taking zinc okay for high blood pressure? I'm assuming that's what you mean. That's from District Missionary Paul. Is taking zinc okay to take with? Is zinc okay to take with high blood pressure?
And you're correct in that being a very specific question that I'm going to have you to refer to your physician, because I don't know your overall health situation. I don't know your overall diagnosis. So for me to sit and to tell you, oh, it's okay for you to take zinc, and now you have this blood pressure medication that you want, I don't know what medication it is specifically. Are there some other medications that you're taking that may interact with that? What your whole picture of health is looking like? It's difficult for me to just sit here and give you a direct answer about that. Again, I will, and you're probably thinking, well, I'm not going to answer any more questions because she's not answering anything about medicines or foods or whatever. But I don't want to give you any information that's wrong. And I don't want to give you a blanket answer that's not going to be, there is no blanket answer. Everybody's different. So you may have something in your health history that I'm not aware of, and I sit here and tell you something's okay when indeed it's not okay for you. So I can't put myself in that position, and I don't want to put you in that position either. So if you are, and I believe I forgot when it was, but Dr. Pepe did give us some good information about some supplements that we can use. If you want to go back and refer back to his information session, maybe Jasmine's able to give us that date. I can't remember the specific date where he went over all of that. He did give great information about supplements. But even with him giving you that information, and if you notice when he was speaking, it was certain things he wouldn't even really dive into too deeply, just because we don't know everybody's situation. So if it's something you heard that you think may be good for you, or you think you may want to try, just like with anything else, just like if you were to start a new exercise regimen, you want to talk to your physician about that before you do it. If you are under a doctor's care, you do want to talk, because they're going to be the best person to give you information about that. Also for you to follow up. If you start something new, you need to make sure that you are attending your appointments, as I said before. Follow up, let them know how it's making you feel, because you may take something and it's not making you feel good. They need to know about it, because that's some type of reaction that may need, it needs to be documented, it needs to be taken note.
Thank you so much. I have one more question, and this will be our last question for this session. And then I am going to open the floor to Dr. Foster as well. This question is from Sister Ramona Hardy. She said that, I know in the hospitals there's a way to take off your PPE. Is there a specific protocol that you recommend for non-medical persons removing PPE?
Yes, I wish I had a pair of gloves in front of me, and I don't. But there is, and that is a very good question, and thank you for pointing that out, because that goes for anybody, whether you're in the hospital or you're not, because like I said, there are people that are out here, I see them walking around with gloves, with their mask on. They may not be all gowned up, but yes, there is a proper way to take it off. When you have on your mask, if you just have on a regular surgical mask or so, and I'm just going to put this on so you can see. Remember, when we have on our mask, this is supposed to be catching particles or any bacteria that may be hitting us, right? So, and I just popped this one, but I don't want to grab it like this and just take it off. If you can, I'm just going to use another mask because that one popped. So when you have it on, if you can, try to grab it by the loop that's behind your ear, remove the other loop, and then remove it away from your face. You could sit it on, a surface, or if you're taking it in the house, or if you're hanging it here, but the point is not to have it touching and lingering everywhere. When you have on a glove, the glove is on your hand. You have the rim of the glove that's around your wrist. If you can get a finger under that and fold it down and bring the glove inside and do the other one where you're not touching the inside of the glove so that you're not contaminating your hands, you want to then toss those gloves. There are, again, I'm going to refer you back to websites. So there are videos there that can show you how to properly place on a glove or a mask and properly take them off. But that was a great question, and I thank you for that, because we want to, just as much as we're protecting ourselves, when we take the things off, the stuff that's been hitting our gloves or the stuff that's been hitting our face, we want to protect ourselves from it, right? So we don't want to touch it. So when you're taking off your mask, and then the other mask, I showed you the one behind the ear, but this mask here, the one where we put both things behind here, we want to make sure that we grab one, bring it over, and grab the other. We can kind of touch under the rim to like take it off this way. And then if you're disposing of it, you dispose of it. But with some of your cloth masks, I know you're not throwing those away, so you're gonna put them to the side where you can wash them. Also, if you have to be in a situation where you're out, some people are now going out to restaurants and they're eating or so. If you have, they're telling us, like, if you have a little brown paper bag or something, or even if you have paper towel where you can open it up and set your mask down in a paper towel and fold it over, because remember, you're putting this back on your face. So you don't want to take this off and set it on the table, and the part that's going on your face is sitting on this table, and then you're putting it back on your face. So if you have extra paper towel with you, you can set it in the paper towel and then open it back up and use it. If you have a brown paper bag, you can use it. And I'm mentioning paper just because that's a breathable product versus sticking things in a plastic bag where, there's not really much airflow. But it's nice just to carry something extra with you, where if you're out and you have to take it off in the case of eating, that you have someone somewhere to put it.
Okay, thank you so much. Lady Kelly did ask what PPE is, and I see that some of you have answered. It is personal protective equipment. Just so everyone will know what we're referring to with those acronyms. But thank you so much, Nurse Henderson, for your time for this presentation. It was so well put together, so much information, a wealth of knowledge, and we really appreciate your time and efforts in putting this information together. Because while it is public knowledge, it still takes time to gather these items and put them together. So we do appreciate your time and efforts. I do want to acknowledge all of our medical professionals that are on the call today. I do not know every single person that works in the medical field, but I do want to acknowledge you all of our frontline workers and those who have been working with us through the pandemic. I do see my other cousin, Nurse Kendrika Littlejohn is on the line, and I am going to give the floor to our very own Dr. Lorna Foster, who has some information that she'd like to offer as well. I do see your hand, Lady June.
Yes, just before Dr. Foster comes up, just in case someone joined after the disclaimer, I just want to reiterate the disclaimer again. The information that has been disseminated in this presentation should not be used as medical advice. Please speak with your physician to receive the medical information that you need regarding COVID-19. So the information that Dr. Foster is going to disseminate should not be used as personal medical advice. Please seek your physician. Thank you.
Thank you. Thank you so much. So each and every one of you that are on this call that are medical professionals, EMTs, in whatever capacity that you work in, if you mop the hospital floor, we thank you, because you are still needed to get the coronavirus germs out of the mop. So we thank you for that. But we're going to give the floor to Dr. Foster. Hang on with us just for a few more minutes. We want to give you a little bit more information, and then we will be wrapping up shortly. Thank you so much, Dr. Foster.
Yes, hello, can you hear me, everyone? Can you hear me? Okay, great, wonderful. Thank you, Nurse Henderson. That was beautiful, comprehensive, and well put together. I learned a lot myself. I am a pediatrician, but I'm also a patient. And a few things came to mind as Nurse Henderson was talking. We are going back into our churches, so I wanted us to be aware of some things. We are going back into churches, and people of all age groups are going to be coming in. And as Nurse Henderson told us about many people that will have chronic conditions, immunocompromised conditions, I want our leaders to make sure your parishioners are regularly going to their physicians, and obedience is better than sacrifice. Encourage everyone to have their conditions controlled, because a lot of, as Nurse Henderson will be able to tell you, people coming into the hospital who are getting sick often have uncontrolled conditions. Someone else asked about supplements. What has been found in people who have worse outcomes are very low vitamin D levels. And in our population, specifically African Americans, anyone with melanated skin, we have very low vitamin D levels. We don't like going outside. Many of us are lactose intolerant, and milk is the main source of vitamin D. So there is a risk of greater negative outcome with low vitamin D levels. Regarding the zinc is in a lot of multivitamins, and multivitamins can be taken with a number of medications, heart medications, high blood pressure medications. I think people do have a common assumption that zinc, vitamin C does boost your immune system, and that is true, but that is considered an adjunct to your traditional medical treatment. So you do want to make sure your underlying illness is controlled. I also wanted to mention about children. Children are asymptomatic carriers. They're not getting as sick, but they're the ones who can pass it along. So as we're opening up our churches, if you have sick children, those are the ones who probably do not need to come. We may need to stay home on those days, okay? Another thing that I wanted to mention is we're going into buildings that have been closed for periods of time, and there can be inherent risk in that. For instance, if you have a building where your water temperature has gone down and you're going in and you're going to start opening up those pipes, there's something called Legionnaire's disease that can cause severe respiratory illness. Nurse Henderson probably has taken care of people with severe respiratory illnesses, perhaps from Legionnaire's disease. And if we're going into buildings that have been closed for long periods of time, you want to make sure your hot water heater is at least 140 degrees and that you run water through those pipes until the water is at its hottest temperature. We also want to be cognizant of things like mold and dust that may have settled, so changing our filters in the church would be very helpful. I also think that it's important because we've been talking about how we have dominion, man has dominion. This chain of command from God to us taking care of one another would include us being properly equipped in our churches. I think that in our churches, someone should make sure there's someone who is CPR certified to attend to the needs of someone who may become ill during not only the COVID crisis, but other things. In particular, I know we have thermometers, but having a pulse oximeter is very important because in early stages of COVID, when there is decompensation from a respiratory standpoint, the pulse ox level is coming down. And so just sticking that on someone's finger that might not be feeling well is important, okay? And be ready to act in a moment. Frequent sanitizing of hands, also sanitizing of the wooden parts of the pews. I know at Lighthouse, when we were taking up offering, we would go in a line. I don't think that is the form we're doing it in now, but frequent desanitizing of parts where people are frequently touching, like the backs of pews. Lastly, I want to encourage every adult here today. And of course, I'm a pediatrician, so I'm a great proponent. I'm a great advocate of vaccines. But one of the ways that we can prevent ourselves from getting sick is getting our vaccines. We want to make sure in this flu season, everyone is taking due diligence to get your flu vaccine. Because we're going to be hit with a double whammy, flu and possibly COVID. Medical health professionals are going to have a hard time determining what you're sick with, flu or COVID. If you've had your flu shot, it makes it easier to determine how to proceed with treating your medical concern. There are also shots out there to boost your immune system. After so many years, when you've had shots when you were younger, your antibody titers do go down and you're no longer protected. So ask your doctors about the pneumococcal conjugate vaccine, the shingles vaccine, and the tetanus, diphtheria, and pertussis vaccine. Also, I wanted to let you know that out of all the people who have had COVID, only 10% are testing positive for antibodies. Antibodies does not ensure protection. That antibody protection, we don't know if it is truly protective, how long it's protective. So as Nurse Henderson encouraged us so strongly tonight, please wear your personal protective equipment, continue to wash your hands, and make sure we're taking care of one another. And consider, pastors, when you're bringing people back into the church, talking to people who are more at risk about maybe sitting further apart, maybe being willing to sit at the back. Make sure we're aware of our surroundings and people, how they're feeling around us, so we can bring it to the attention of an usher or a healthcare professional in the congregation that someone is in need. Thank you for this time that you've given me in your hearing. God bless you all. Wisdom is the principal thing.
Thank you so much, Dr. Foster, for that additional information. And there are so many things that as leaders, administrators, pastors, things that we may not have thought of. So that information is pertinent and very much needed. So thank you both, Nurse Henderson, Dr. Foster. Thank you, Lady June, for putting this together for us. And I want to just take a few moments to cover a couple of things that she asked me to talk about as it relates to returning to our sanctuaries. Bishop has joined us, and I'm going to make sure that I give him the floor to address us before we close out tonight. But he did ask me in this setting to show you our re-entry video for Lighthouse Worship Center. And then I'm going to take just maybe about 10 minutes or so to talk to you about some resources that our pastors and administrators and even lay members on the line can use to use when you're re-entering your sanctuaries this coming fall, or for those of you who have already re-entered your sanctuaries but just need some more information as it relates to opening up your sanctuaries. So we're going to take a moment just to look at this particular video, and then like I said, maybe 10 minutes or so, give me about 10 minutes to go through some items with you. Give me just a second. Here we go. Okay.
You have spent months learning new ways to stay connected and stay active as you You have spent months learning new ways to stay connected and stay active as you worship with us from home. It may not have been easy, but you've done an awesome job. We thank you so much for continually watching and commenting on our streams, but we've missed seeing you in person. Please know that when the time comes for us to reopen our doors, we'll be ready to welcome you back. The overall health and well-being of our church family and guests is our #1 priority. So we've made some changes to make sure you will be coming back to a safe and clean worship environment. Prior to and immediately following each service, the sanctuary, lobby, and restrooms will be thoroughly cleaned and fully sanitized. You will also find several air purifiers located throughout the building, an increased number of hand sanitizer stations, social distancing reminders, signs showing where to and not to sit, and additional guidance to ensure your safety and comfort. Reopening of the sanctuary will be limited to Sunday mornings only. For now, we will not resume evening services. Doors will open on Sunday mornings at 9 a.m. to deem ample time for screening and seating before Sunday school begins. Bible study will remain as a virtual experience for everyone. Upon your arrival, you will be greeted by our parking lot and security teams. These teams will guide you to the nearest parking space, and you may be asked to remain in your car until your neighbor has exited their car and is at a safe distance. Please note that unless you are a part of the finance, music, or security staff, you will enter and exit the building from the front lobby area. There will be one entrance side and one exit side into the building and into the sanctuary. You will notice the social distancing reminders as you enter the building. Upon your entry, you will be required to wear a face covering for the entirety of your stay. You will be met by a member of the greeters or hospitality team, and your temperature will be taken. Please note that if your temperature exceeds 100 degrees, you will be asked to take a seat in the lobby, and you will be scanned again in a few moments. If your temperature persists, you will not be granted entrance into the sanctuary, and you will be asked to exit the building. Those that clear the temperature check will be asked a few short questions as it relates to your health and any symptoms you may be experiencing. Please answer honestly so that we can further ensure the health of all our members. If your answers are acceptable for entry, you will then be offered a choice of wristband to note to the public what type of contact you are comfortable with. To enhance your contactless experience, please take advantage of our QR code station, where you will be able to scan with your phone and access the most up-to-date information as it relates to the ministry. You will be asked to sanitize your hands before entry into the sanctuary. You can use any of our lobby sanitizing stations or proceed to the restrooms to use our newly installed no-contact hand washing stations. In continuing to comply with social distancing standards, only 2 persons will be allowed entry into the restrooms at a time. You will be greeted by a member of the usher board upon entering the sanctuary. They will instruct you on where you and your families can sit while recognizing social distancing standards and filling the sanctuary from front to back. Please note the signs on each of the pews and follow the directions of the ushers. Upon the close of the service, parishioners will be dismissed by section to observe social distancing guidelines while exiting the building. Everyone will use one exit. While it is encouraged to continue giving online, you will have the opportunity to drop your physical donations, should you choose to do so, in the lobby receptacle as you exit the building. Please prepare to bring the exact amount that you would like to give, as no change will be provided at this time. When you're ready to worship with us, we're ready for you. We're doing all this and more to ensure that when you come to the Lighthouse, you come to the right house. We can't wait to see you. Until then, stay safe and stay connected.
Okay, so hopefully you enjoyed that particular video that was created for Lighthouse Worship Center. So I'm just going to share with you a couple of items that we have purchased at our particular ministry that will be helpful to some of the other ministries. This list isn't limited just to these things that you can purchase or use. Please, as even Nurse Henderson has already said, you do what works for you, what works for your particular congregation. I just want to share this information with you, and then you can take what's useful for you. Okay, and as always, you can reach me for more information. So these items that you see here are air purifiers and these particular purifiers. So this one that's this kind of hourglass shaped looking one is the smaller one that can be plugged right into an outlet in the wall, and it has a UV light in it as well. Okay, so it's a much smaller air purifier that can be found on Amazon, and actually on the next slide I'll show you the specific name of it so you can look for it for purchase. This larger one we have about, I believe it's about 7 of them located around the building. This larger purifier that has specific filters in it to filter out particles and toxins in the air. So we have these running. We actually begin them purifying about an hour before our services begin. So we can already have the air begin to purify before the saints come into the building. Okay, so those are the 2 air purifiers that we use in our particular church. And let me just also say this. Any of these items that I recommend to you can also be used in your homes, okay? Some of these items Bishop has actually purchased and put in his home as well. So feel free to use them in your homes. Even as laity, feel free to purchase them and use them in your homes. This stand that you see here at the bottom, those are our sanitizing stations, and I'll share the information on where I got those from. I believe it's on the next slide. And then, of course, masks that are sold everywhere at this point. You can purchase masks. You want to make sure that you have at least a box of masks available to your parishioners, just in case there are those that come and forget their masks. For whatever reason. At this point, I know we're kind of used to wearing them, but if they forget and leave it in the car or what have you, you've provided something for them to place as a face covering. Okay, so let's go to the next slide. So this is where you'll purchase the air purifiers, okay? So the larger one is the Medify air purifier that I showed you. It retails at about $270. Just for a few more dollars, you can get them in a pack of 2 as well. So that was the larger purifier. And then the Germ Guardian pluggable air purifier is the smaller hourglass shaped one that I showed you that retails at about $35. Now, what you want to do, this is important when it comes to these air purifiers, is to look at the specs when you are purchasing, so you will know how much of a region it will cover in your building, okay? It's not going to be effective if you have a large space and you only have one particular purifier covering one particular area of space, okay? So you want to look at the specs to see how much coverage each purifier has, so you can make sure that you have enough purifiers to cover your square footage in your buildings, okay? Now, the sanitizing stations that we purchased at Lighthouse Worship Center, this is just where we purchased ours, was at the dispenserfactory.com, okay? At the time, the COGIC ones were not available, which is why we didn't purchase the COGIC ones, okay? But at the Bishop's Church, we would have had the COGIC seal on our hand sanitizer stations. But the COGIC ones were not available at the time that we purchased. So I got them from dispenserfactory.com, and the shipping is very quick. That company is located in Miami, Florida, and they usually ship the next day if you are looking to purchase there. But you can also go to the COGICpublishinghouse.net, and if you'd like any masks, sanitizing stations like the one you see here on your screen with the COGIC seal on them, you can purchase those items on our Church of God in Christ website as well. Publishing house website, okay? Not COGIC.org, but where you would purchase your Sunday school material and any COGIC literature. You want to go to that same website. They also are selling thermometers there on the COGIC publishing website as well. So you can purchase those items there. And just remember, I'm recording this session, so if I'm going a little too quickly, you can always go back and view it. Okay, next, signage. Okay, now a lot of the signage that we use at Lighthouse Worship Center, I personally created. Okay, I created those signs. I laminated them and then I put them around the church, but I will let you know where I got the information from, okay? So I didn't sit and personally do the graphics, but I did get the information, I pulled the information, and then I was able to print and laminate them myself, all right? So you can go to the CDC website, which has been mentioned a couple of times in this presentation already, and they have signage on the CDC website that you can use at your places of worship, okay? Signage varies, but you can put up several signs: hand washing signs, sanitation signs, signs of symptoms when you have parishioners coming into your buildings, okay? So go to the CDC websites. Those signs are free. You don't have to purchase them. All you have to do is download them, print them out, okay? And if you're putting them in a place that's going to be exposed to the elements, you may want to go ahead and laminate those so you won't have to keep recreating them if they get rained on or, you know, what have you, okay? So you can go to the CDC website. You can also purchase on Amazon. So some of the stickers that you may have seen on our pews in the video were purchased on Amazon, letting people know where they can and cannot sit, okay? So you can always purchase COVID signage on Amazon, and those floor decals and the floor stickers can be purchased there as well, okay? So CDC website, Amazon is always going to be your best friend, and then you can print those items from those sites and laminate them and use them yourselves, okay? Okay, and I think last but not least, we're going to talk about any additional items that you may need. So at Lighthouse Worship Center, we changed our hand washing stations to be touchless hand washing stations, okay? So the soap dispensers are automatic and the paper towel dispensers are automatic stations where you won't need to touch those any longer to retrieve soap or paper towels, okay? So the two websites that I particularly used to obtain the soap dispensers was Amazon, okay? These are the soap dispensers that we have at Lighthouse Worship Center. This particular soap dispenser I like because it can use any type of soap, okay? So the soap dispensers that we had previously where you had to push with your hand to get the soap out, I had a bunch of that soap because we buy it in bulk, but I was able to use that same soap and put into the new hand soap stations. and we could use the touchless soap there. If you have foam soap, it will work with foam soap. And they'll also tell you on Amazon that this soap dispenser can also be used as a hand sanitizer dispenser as well, all right? Now, like I said, this is just suggestions for what we use at Lighthouse Worship Center. You use what's going to work for your ministry, okay? Both of these items, the soap dispenser and the paper towel dispensers, are battery operated, okay? So you want to keep that in mind, and you will need to mount them on your walls, okay? So they are not freestanding. You will need to mount them on your walls, and they are battery operated. The paper towel dispensers came from Global Industrial, and you can go to globalindustrial.com. They have all types of COVID items there that you can purchase to help with your ministry. And the soap dispensers came from Amazon, and they also have these soap dispensers at the dispenser factory, which I mentioned already. Okay, if you need additional items such as partitions, dividers, and shields, I know we have face shields at our temperature station as you're coming into the sanctuary. You can also purchase those at Amazon or Global Industrial, okay? All right, and I know a couple of weeks ago, I sent out an email to the pastors on a deal that I found for the hand thermometers. Going into some of the physical stores, you can see hand thermometers upwards of $45, $50. But the deal that I found on Groupon and now on Amazon, they have the hand thermometers for $9.99 and $12.99. So you want to catch those if you are in need of thermometers for your ministry, get them before the prices go up, okay? Okay, and last but not least, just to reiterate those items that Dr. Pepe mentioned to us when he was here, and Nurse Henderson already mentioned, recommended going back to view some of the things that Dr. Pepe talked to us about. He did offer the recommendation of the snake plants, okay? Snake plants can be found at your local nurseries, Home Depot, or Lowe's, and this is a picture of what it looks like. The snake plants can be placed at the entrance of your homes, the entrance of your worship buildings, and they are God's natural air purifiers, okay? So if all else fails, put a couple of snake plants around your building, and you can have the natural purifier with that. And then the ionizers that he recommended here, the information is here. I know some of you all were reaching out to me to find the information for them. So you can go to ibreathesafely.com to purchase these, and I can send this information out to you as well, or you can scan this QR code to find the products and purchase them as well. Okay. Okay, so I am going to, if anyone has any questions as it relates to those particular items, I'll take a couple of those questions, and then we are going to close out for this evening after hearing from our bishop. If anyone has any questions, feel free to type them in the chat. Like I said, the information that I offered, it's just based on what we did at Lighthouse Worship Center. You do what works for you at your particular ministry, okay? But I am more than willing to share any other information that I have as it relates to the precautions that we've taken at Lighthouse Worship Center, okay? I also know that I've personally recommended the sanitizing company that Superintendent Lovett and Lady Lovett have been using, and the young man that is a member of their church that has been sanitizing a lot of our ministries. So feel free to reach out to him. I can send his information to you as well if you need someone to come in and professionally sanitize your buildings. I know Bishop has also been speaking to the members and the pastors about the 28-day kill germ patrol that you can spray in your buildings and on your hard surfaces. And let me just make this disclaimer: it kills the coronavirus up to 28 days, okay? Up to 28 days, okay? All right. And he did mention that they are coming out with a 91-day kill as well. So he'll be giving the information on that as well. All right. But any of these sanitizing measures can be used in your churches and in your personal homes. The website, the ibreathesafely.com, that was referred by Dr. Pepe. He also has the purifiers that you can put in your cigarette lighters for your cars, as well as the ones that hang around your neck, and then the ones that you can plug into the wall that sanitize the air in smaller areas. So maybe if you have a small office or a bedroom or something like that, you can plug those up into the wall and it will purify those particular areas. Okay. Feel free to email me. Most of you on this call have access to my phone number. You can call me or text me. I am an open book, so I will make sure I share all of this information with you if you have any questions, even if later on down the line you think of something and you have some questions, feel free to reach out to me or to email me. Okay. Bishop, are you available? Are you still on the line and available? Do you want to address the people just before we close out this session for tonight?
He's coming up in just a second, Jazz.
Okay.
I just want you make a small insert, and then
Sure.
followed by that, then Bishop will be addressing you all.
Sure.
So I just wanted to just make mention, I work for a consulting company, and we deal with a lot of billion-dollar pharmaceutical companies. And as many of you know, they are currently working on a COVID-19 vaccine. And some of us, you know, from what I'm hearing, will decide to take the vaccine, and then some of us have already decided not to. I just want you to do your own research as it relates to the clinical trials. And because I studied the clinical trials, it's basically vaccines and medications that are given to patients prior to these medications coming out on the market. And if you study the clinical trial, it will tell you what has happened to other patients that has taken these vaccines or medications. So CNN just posted an article about a big-time pharmaceutical company that had to end the clinical trial because not only did someone pass away during the clinical trial, but there were so many unknown illnesses that were unexplainable, being that one patient actually had spine damage due to this vaccine. So when the vaccine actually comes out, I encourage each of you to do your own research and talk to your doctors about the clinical trial. And that's not only for COVID-19, but that's for any medication. Before you take any medication, you should know your underlying issues and the side effects to that medication. So if you have a, contraindication or some type of allergy, you should know what's in that vaccine or what's in that medication prior to taking that medication. So please, I hope that I encourage someone moving forward to never just take a medication because it was prescribed to you, but learn what are the contraindications and research the clinical trials that will tell you what has happened to other patients. So hopefully that was helpful, and we are all more informed. Thank you, Nurse Henderson. You did an amazing job. Dr. Foster, thank you so much for your input. And I hope that you all really, really learned and enjoyed the presentation. And at this time, I present to you our leader, Bishop Jimmy Williams.
Our leader, Giselle. First of all, I got a question for Dr. Foster. Since you are a pediatrician, what medicine would you prescribe for babies that are spoiled?
You can't spoil a baby under 6 months old.
Oh, you can't?
No.
Okay, she's 10, so what do you...
Okay. So, it's called the Ferber method. We'll go into that in a little bit more detail.
Okay.
But put an unspillable sippy cup in her crib and put a little water in there and just kind of let her cry it out a little bit. She's just trying to wrap you around her finger. She's already got that done.
Yes.
You let her crawl to her sippy cup. She'll be okay. She can self-comfort now.
Okay. I had to come upstairs to get on the computer because my phone copied off of me and it went to sleep. But I actually dreamed I was on a Zoom call while I was down there. But this presentation has been just tremendous, and certainly thank all of you for what you have done to bring this to fruition. We are thankful for that. It is at this time in our lives and at this time in what we're going through that we be extremely professional when it comes to our presentation, giving out advice and things of that nature. So I'm very glad that we have the personnel and clientele to do that. So I'm thankful for all of this. I've enjoyed everything that I've heard, conscious and unconscious, and I'm so grateful that we were able to do this on this evening for the entire jurisdiction. I hope that quite a few of the pastors were on so that they can both hear and understand what is necessary as it pertains to these times that we are living in. So we're grateful for everything that we've heard. I've enjoyed everything that I've heard, learned some stuff too, because I was trying to figure out what COVID-19 was. Now I know. I don't have to ask no more because I learned it today. Okay, this is what I need an explanation for right now. But thank you all again for being a part of this setting here. And we're grateful to have had you on this. Now, this is just, I would say, the first of several presentations that we're going to be making until we get out of this thing. And I was listening to you, Dr. Foster said, make sure you take your flu shots. There are so many people that's even afraid of that. You know, that's kind of like say, no, I'm not taking no vaccine. I'm not doing anything. They're afraid of it. So maybe you can give some insight into that as it pertains to a flu shot, because I've even been given advice, Bishop, please don't take no flu shot because, you know, these kind of things have caused us. You want to go? Yeah. Right.
Bishop, sir, if you would give me a moment to address the people about that.
Yes.
Okay, so in medicine, as Nurse Henderson would know, there are a lot of things that happen that are uncomfortable. Of course, you have preached, Bishop, before that before we heal, sometimes we have to get cut. Sometimes we have to go through a moment of discomfort for a lifetime of health, okay? Mm-hmm. In medicine, we never do anything where the risk outweighs the benefit, okay? And everything you do in life has an inherent risk attached to it. So that's just wisdom. The flu shot, every year, there are many strains, as Nurse Henderson talked about, many strains of the coronavirus. There are many strains of the flu, and each year the flu shot is developed based upon a best guesstimate of which strains are going to be most predominant that particular season. Okay. The reason we want you to get a flu shot is because the respiratory system is very vulnerable to complications to the flu. We have many people dying every year because of complications of the flu, but then it also adds to a great risk of morbidity, including a great risk of mortality. So the question that one has to ask themselves is, do I want to take a chance? Do I want to get this flu shot where there is a greater benefit for getting the flu shot than risk for not getting the flu shot? Of course, when you get any vaccine or anything, if you take a aspirin, there's a potential negative outcome. But if you're doing it to prevent a heart attack, a massive heart attack, you would probably take that baby aspirin every day. So the same thing pertains to the flu vaccine. This year's is especially pertinent because we do have this COVID-19. It is devastating. We've lost so many people, even in our own Church of God in Christ. We've lost great leaders. We've lost people in our families because, while the outward man perishes day by day. They may have been vulnerable because of age, pre-existing illnesses, but if you can prevent getting something that is an external risk to your health, like the flu shot, I definitely have no reason to tell someone not to get it. I heard Lady June speak about very bad outcomes. We do have adverse vaccine reporting systems where we report negative outcomes for vaccines, just so the general public is aware that, you know, you can get a flu shot and walk outside 2 minutes later, get hit by a car. That's a negative adverse because it was within a close period of time. You can get a flu vaccine and 2 months later end up with multiple sclerosis. Did the flu vaccine cause multiple sclerosis? Probably not. Is there a 0.0001% chance that it did? Maybe. Is there a greater than 50% chance or at least 40% chance that you could have prevented the flu from yourself getting it or passing it on to someone else if you had gotten the flu shot? Is that a possible reality? Yes, it is. So people with things like asthma, I'm a pediatrician, rarely do I support parents not giving a flu shot to an infant between 6 and 35 months. Sounds like Giselle is probably at home all the time and she doesn't have a lot of risk factors, but for someone like Giselle, I would recommend that you and Lady June got the shot and the other children in the home, because that's how we gain what we call herd immunity. The people around her are protected, therefore she's protected, okay? So I don't have any opposition to the flu shot. I totally recommend it. I don't know if that answered your question. There are other vaccines I recommend because as a physician, I'm able to do antibody titers to see if someone is protected against diseases that can cause morbidity and mortality. Ignorance is not bliss. So that's what I have to say about that.
Okay. So primarily, it's not in the lab being tested or anything. It's not under review. It's actually something that is
FDA approved.
FDA approved. Okay.
Yes, before it comes out to the general public, there have been clinical trials. People volunteer like they're doing for these COVID vaccines, and then they decide at the end of several phases of a clinical trial whether or not it's safe enough to present to the general public and whether we feel that it would be an overall benefit to the public to have this available. Okay. So it's not just something that's developed and there's no testing, and that goes for all medicines that are pretty much on the market. Certainly, like our President Trump was able to get things that were not FDA approved or not on the market, and he was able to receive some of those treatments that were supposedly beneficial for him, but that is not the general rule of thumb. That is not the way things proceed in medicine.
Okay. Now let me expose some of the mindsets that have been exposed to me. I think it was CVS and Walgreens say you get a flu shot, then we'll give you a $10 gift card. And some people were saying, oh no, that stuff must be old. That's why they're trying to get rid of it, like food on the shelf, you know. So I said, no, I don't know about that. It's just that I will wait to get some advice before I get it. What is your response to a mindset like that?
That's just trying to encourage people to create a community and a population of healthier people.
Okay.
And money, for some people, money speaks. And then the herd, that's where the idea of herd immunity, the more people around vulnerable people who cannot get that vaccine, there are people who cannot get it. Like someone who may have had an adverse reaction in the past. The babies, for instance, any baby under the age of 6 months cannot get a flu vaccine. And how devastating would that be if an infant, there was infant demise based upon her family, her parents, who refused to get the flu vaccine. So it's all about creating herd immunity, creating a healthier community. $10 is not making anyone rich, it's just an incentive. You know, it's just like I give a lollipop to my patients after they get their shots. It's an incentive.
Okay. Well, now I can better answer some of those questions that they pose to me. Sometimes when you're the bishop, they think you know everything, but I don't. You know, I don't even know as much as Shonda know, but you know, I try my best. But we're thankful for that. But thank God for all of you on this evening. This has been quite informative, and I am glad that we were able to put this together. Like I said, this is one of several that we'll be coming out with. So we want to thank everybody who had a part in this, the idea, the cultivating, the presentation, all of that. Thank everybody for that. Thank God for Aunt Linda being on here too. I see you. Thank God for her being on here too. So I'm grateful for everything that has taken place, and I am pleased with it. And thank God for all of you. Pastor Bird posed a question. Does anybody want to entertain it? Pastor Bird?
Yes, in the past, when I did receive the shot, I've gotten sick. My mom even got real ill.
With the flu shot?
Yes.
Okay.
So I don't take it. So what else do I, that was quite a while back. Do I try to take that chance now? I'm old. I'm not young anymore.
Yeah, you had stopped drinking then?
I wasn't drinking. Bishop, I never really drank.
Okay.
Can I share this with y'all? I told Bishop I was under the weather. He told me to get from under the weather.
So you're looking for an alternative to a flu shot that
now some have said that if you take it within minutes or so, take an aspirin.
I wouldn't know.
Okay, I can speak to that. Okay, so I would first of all refer you to your primary care physician and just have, ask them, be very frank with them about your concerns, okay? Because there is something to that, but the flu shot does not cause the flu. So whenever, and Nurse Henderson, please jump in whenever you want to. When we give a vaccine, it is something that's manufactured that looks like the antigen that we're trying to protect you against. So it gets inside of your body and it produces an immune response. And in that process, just like when you get sick, you get a fever, right? You don't feel good when you get a fever, right? Fevers make you feel horrible. But your fever lets you know that your immune system is working. If you couldn't mount a fever, your immune system couldn't mount white blood cells and things of that sort to fight infection. So yes, it is very possible to, after the flu shot, feel achiness, chills, a low-grade fever, a headache. You can feel like you have a mild case of the flu. But that is your immune system working. And people do not die from the side effects from a flu shot. And that is a common side effect for a lot of vaccines: muscle aching at the site of the injection, a low-grade temperature in the first 24 hours. But because I'm a pediatrician and I'm not an internist, I would implore you to talk to your physician who can give you the proper reassurance and just not go out and get one. So, but the contraindications for it's not a live vaccine, so it's not contraindicated for people who are immunocompromised. So if you have an immunocompromised system like diabetes or some immune disease, that is you're the one that's supposed to get it. Okay.
Well, I have a low white cell count.
So you would talk to your there's a couple.
They have already tested me, and they say they come to the conclusion I'm normal.
Right, because in the African American, right, in the African American male population, a low white blood cell count is part of the norm. Okay, so in the African American male population, yes, a lower than average white blood cell count, based upon what the lab is going to tell you, can be normal. They've checked your immature white blood cell counts and all of that. That is not an uncommon thing, okay? So you're probably healthy in that regard, but if you have any other immune compromised situations like diabetes or—
I'm diabetic.
Yes, absolutely. You definitely, because you're at risk for secondary infections. you need to talk to your primary care physician to get a little bit more reassurance. I mean, because that's part of our job is to reassure you.
Okay, thank you.
You're very welcome.
I'll just stay away from the bishop.
I'm the intervention that you need. All right.
Thank you very much.
Yeah, Pastor Bird, that's my friend. But we are thankful once again for all of the information that we received, and hopefully we were able to deal with some of the fear that is out there, because when you are informed, it really should lessen the fear. When you know what you can do, what you cannot do, or what you can expect if you take a shot, or if you're going to do preventive measures for the disease that's out there, it can help take away the fear. So thank you all again so much for this, and we'll look forward to you all looking at the Sunday school lesson in the morning. How about that? All right, Jazz, you done?
Yes, thank you, Bishop. I just wanted to, last but not least, this isn't directly related to coronavirus, but if there are any pastors, administrators, or laity on the line that want to pass along this information and you need assistance with setting up your virtual services, I know at this time we've been doing them for a while, but a lot of churches have been doing them on Zoom. So the transition from Zoom to Facebook or whatever other platform that you want to use, feel free to reach out to me as well. And we can get some tools, resources, and information over to you on how to set that up as well. All right, for those that are returning to your sanctuaries. Thank you so much. Thank you again, Bishop. Thank you, Lady June. Thank you, Nurse Henderson and Dr. Foster. Thank you all for joining and taking your time this evening to get this information. We really do appreciate your time and your efforts. And as Bishop stated, we will have settings like this in the future so that we can have more practical conversations around what we can do naturally to support ourselves even spiritually. Prayer is good, fasting is good, reading your word is good, but if you can also cover your mouth when you cough, that is great. So thank you. All right, so thank you so much, each and every one of you. That is all for me. God bless you all. Have a wonderful weekend, a wonderful time in your services tomorrow, and please reach out to me with any questions or concerns.